first of all, there is hyperresponsiveness of the tracheobronchial smooth muscles. Tracheobronchial smooth muscles. So this is the first thing which is recorded, that the tracheobronchial smooth muscles have started to show hyperresponsiveness, right? And this leads to a lot of events, I would say. First would be there is mucosal edema. Edema means accumulation of the fluid. Then there is mucosal plugging because of excessive release of the mucus. It starts to accumulate and plug. Then there is increased secretions. Why I have mentioned only here secretions? Because a lot of secretions are triggered here. The release of phospholipids, the release of mediators, the release of mucus, and the release of the loss of blood from the blood vessels. All of those collectively leads to increased secretions, which mixes up with the mucus and causes edema and plugging, right? And these three events further leads to these symptoms, which are wheezing. Wheezing is, I already mentioned in previous lecture, that wheezing is the sound created when you breathe or when you heavily breathe. There is a sound which you emit, that is called as wheezing, right? Or probably during sleeping, or probably during talking. And then there is coughing. Coughing is also one prominent factor. So wheezing and coughing and shortness of breath, or we can say dyspnea, right? Just confirm the spelling. Dyspnea, that is shortness of breath. Shortness of breath. So due to the hyper-responsiveness or hyperactivity or hyper-responses of the tracheobronchial smooth muscles, the tracheobronchial smooth muscles which are lining the lungs, which are present inside the respiratory tract, they start to show hyper-responsiveness. Hyperactivity. And this hyperactivity triggers the release of the mediators, the phospholipids, the genes, the mucus, and collectively all of this accumulates. Supposing if this is the passage and everything accumulates here, so basically you are narrowing down. Now only this much amount of space is allowed for entry or exit of the air, which is basically you are causing a suppression of passage of the air. Now if I say, I'll give you a better example. See, if this is the passage, if this is the diameter of the passage for the air to pass through, because air has to be regularly exchanged. There is continuous exhalation and inhalation of air happening inside the body by the time we respirate, whenever we are breathing, right? So if this is the layer, inner layer, and this is the free space through which the gaseous exchange is possible, or this is the passage of air, and if the mucus, all the histamines, then the blood loss, then there is swelling also, swelling and inflammation also, everything is happening, and now we are only left with this narrow space, then ultimately we are narrowing down or decreasing the airway entry. This will cause wheezing, coughing and dyspnea. Okay. So now coming back to the factors what are triggered in this passage. So why is all this happening? First of all, there is release of mediators. There is a release of mediators which is happening in the asthmatic condition. Mediators like histamine, then I'll say TNF alpha or tissue necrotic factor. This is tissue necrotic factor. And then histamine, tissue necrotic factor, right? Yeah, then protease enzyme also. Protease enzymes. So these are the mediators which are immediately released. They are actually stored in the granules. They are stored in the granules, and as soon as this process is triggered, there is an immediate release of mediators, which are these, and these are sequentially responsible for triggering other pathways also. We did discuss in the previous lecture. I'm just mentioning these points so that we also have an idea of what kind of treatment options we can choose to deal with them. As I'll just give you one brief example. If there is a release of histamine, so first treatment you can opt for treating the case of asthma would be antihistaminics. So just giving an example, okay? Then or maybe dealing with these, you can give mucolytics, right? So then there is release of phospholipids. Phospholipids. There is release of phospholipids. What are the phospholipids here? Prostaglandins, leukotrienes, and PAF. Platelet activating factor. I'll just give the names. Prostaglandins, leukotrienes, and platelet activating factor, right? Then I'll just come down to the third scenario. What is happening here? I'll remove this one. The third scenario which is happening here is the activation of genes, because genes also play a very crucial role in promoting the pathways, right? So what genes are activated here? Again, TNF alpha has a role to play, and then interleukins, right? Interleukins and TNF alpha. I'll just write down the full form. Interleukins and tissue necrotic factor alpha, right? It's mentioned there. So these are the three releases which are happening. So these are stored in the granules. They are the release of histamine, TNF alpha, and protease enzyme is triggered by the entry of any stimulus which irritates your nasal passage. Then as soon as the mediators are released, they trigger the release of phospholipids. When the mediators are being synthesized and released, the cell starts to release prostaglandins, leukotrienes, and platelet activating factors, right? Then the activation of genes happen, which again trigger the release of TNF alpha and interleukins, right? So all together they are channelizing some pathways. So I'll just mention few of them here. I'm rubbing this off. I think so this is clear to everyone. Is that mediators which are being released, they are causing constriction. When I use the word constriction, that means narrowing of the diameter. Constriction and dilation, these are the two words which we learned in pharmacology. So constriction is basically narrowing down the passage. So what is it constricting? Obviously the smooth muscles. And how is it constricting? Due to mucosal edema, right? Mucosal edema, mucosal plugging, right? And this in turn leads, there is also one more reason which is causing the narrowing of the smooth muscles, that is hyperemia. Hyperemia. So hyperemia is basically the loss of blood from the blood vessels. This blood vessel could be taking the blood to a nearby organ, to any other organ system, to a nearby tissue, whatever. But this is loss of blood from the vessels, from blood vessels. So I'll give you a clearer picture of this. What is all this leading to? In together, all of this is causing an increase in the secretions. The secretions are continuously being increased, right? Okay, I did mention edema. Okay, then this leads to airway obstruction, right? This leads to airway obstruction. Now, coming back to this flow chart, I've drawn this so as to show you what is happening after each and every step. So when the mediators are being released, what were the mediators again? Histamine was being released, then protease enzymes were being released, then TNF alpha, tissue necrotic factor. I told you that mast cells were responsible for the release of histamines. So histamines are basically triggering the allergic condition, and that also initiates a release of excessive mucus in your body. So whenever you have felt that you are sneezing excessively due to maybe some odor or some dust or any other condition, that also triggers the itchiness in your eyes become watery, your nose becomes watery, you start sneezing a lot, and there is accumulation of mucus in your respiratory tract. So similarly, any kind of stimulus, okay, the stimulus could be anything, whatever you are allergic to, that is mediating the release of all the mediators which are responsible for constriction of the smooth muscles. These smooth muscles are present in the bronchial region, right? So these bronchial muscles, they are narrowing down, they are basically constricting. So if this is the air passage, they are already constricting, as in the muscles are constricting, right? And then after the muscles are already constricted, there is accumulation of mucus here. So initially they were constricted, now there is mucus deposition, right? Mucus edema, mucus deposition. This further narrows the air passage, right? Then it is causing hyperemia also. So all these mediators are also causing hyperemia. So if there is some blood supply in the nearby organ, that blood supply is also lost from a specific vessel and has started to accumulate in the respiratory tract, right, in the smooth muscles. So this accumulated loss of blood is also further narrowing down the respiratory passage. Now more secretions are being released, because we have heard that in such kind of an allergic reaction or in such kind of a bronchial asthmatic condition, the information perpetuates from cell to cell. So like one cell is communicating to the other cell, and the similar process is being repeated by multiple cells, leading to huge release of mucus and major constriction happening. That is what leads to excessive choking also, and you feel shortness of breath, you feel problem in breathing, painful breathing. So we did discuss that, right? So yeah, so after this happens, there is airway obstruction, which you feel that your airway passages get obstructed, and this perpetuates, like this is moving forward. This is not stopping anywhere, this is not restricted to a certain region, this is moving from one cell to another. So basically it is like a wave which is enhancing the total reaction, and this perpetuates to cause hypertrophy also. Now what is hypertrophy? This is enlargement of the cell. Enlargement of the cell. So now the cells have started to enlarge also. So when these cells will start to enlarge, these cells, these epithelial cells will further enlarge. This will further narrow down the airway passage. So hypertrophy is also happening, and this causes damage to the bronchial epithelium. This is damaging obviously the bronchial epithelium, because these cells are colliding with each other. They are filled with mucus, they have accumulated all these mediators, they are being triggered, their number is being increased. This is kind of a hyperactivity reaction or hyperresponsiveness due to that stimulus, right? And why are these cells behaving like that? So in the previous lecture we discussed that all the mediators, they have a response to this epithelium, that they start triggering all the cells to start to release the mediators, right, which cause such reactions like hyperreactivity, hypertrophy, hyperemia, and constriction, and mucosal edema. So right, the next, what happens after this damage to the bronchial epithelium? There is an increase in the vagal discharge. So what is this vagal discharge? Basically, vagal discharge is responsible for the release of acetylcholine, right, a parasympathetic hormone, and vagal discharges will further release, it will trigger the release of acetylcholine, which are again responsible for narrowing the airway passage. So it further worsens, you know how, and that in totality all of these steps are responsible for airway remodeling, that the airway passage is remodeled. Initially it was modeled to allow a clean passage and easy passage of air in and out, but then the passage worsens, the cell number, the cell size increases, there was accumulation of blood cells, there was accumulation of mucus, there were a lot of mediators which were triggering the release of information, right? So this perpetuation helps from cell to cell. Right, back to this. So airway remodeling worsens and causes fibrosis, right? So the cells which were flexible enough, now they are getting more fibers, they're getting more fibered, right? And that is not allowing the easy entry or easy passage of air. Then there is neovascularization. I discussed vascularization, accumulation of the blood. And then there is increase in the muscle mass. The muscle mass is increasing. And then there is gland enlargement. The glands are enlarging, right? So I hope you have experienced this. Whenever you experience cough and cold, your gland starts to swallow whatever are responsible for saliva secretion, maybe, right? Or maybe in case of sinusitis also, you feel your nostrils are also somewhere puffy, your eyes get puffy. So all these lacrimation secretion, all these nasal secretions. So all the glands responsible for secretions, because now they are overworking, right? They are overworking due to this allergic response, and now they have started to increase the release of the responses, and that is how they become enlarged, which is also responsible for blocking the passage and causing itchiness and causing irritation in breathing, and epithelial alterations happening. I did tell you that epithelial tissue also grows. So these are some of the conditions we know. So now if we discuss about what are the drugs responsible for managing the bronchial asthma, you can easily pinpoint few of the methods. Even if you can't name the drugs, you can easily know the ways how to tackle this condition. Supposingly, I'll pick up a drug which is responsible for maybe decreasing the release of acetylcholine. What do you say? So we can give a drug which is acting against the release of acetylcholine, right? Or we can give a drug which is mimicking the sympathetic action, right? If you can, either you can neutralize the release of acetylcholine, giving some drug which is an antagonist to acetylcholine, that will neutralize the acetylcholine effect and not cause the remodeling of airway passage. Or you can choose a drug which is sympathomimetic in nature, which is mimicking the sympathetic effect and not causing the vagal discharges to disturb any of the airway passages. Or maybe you can choose a drug which is responsible for decreasing the mucosal edema release, decreasing the use of mucus, or if there is a mucus accumulation, you can go for mucolytics also, which will break the mucus deposited inside the body and is removed through spitting or maybe through the anal passage. Then we can also choose drugs which are responsible for suppression of the antigen-antibody reaction. Everything which started was because of the release of mediators, because of the antigen-antibody reaction. So we can stop it in the first place, right? We can identify the allergen you are allergic to, and we can stop or avoid that antigen, right? We can also go for drugs which are responsible for inhibition of the release of mediators, right? Wait. We can also go for drugs which are responsible for giving a dilation instead of constriction. We can choose the drugs which are causing dilation. We can choose the drugs which are inhibiting the mediator release. We can choose the drugs which are inhibiting the inflammation reactions, right? We can also go for the drugs which are responsible for suppressing the release of interleukins, suppressing the release of TNF alpha, suppressing the release of histamines. So these specific targets we can work upon. So in continued lecture, I'll tell you what are the probable choices of drugs we can pick up, right, on the basis of, because once we know the mechanism, we can always look for drug targets. Like this could be one drug target, this could be one thing which we can avoid, so this entire thing become less worse or eases out. Then we can also look for specific drug targets. We can also learn about the mechanism of action of a certain drug. That is, we'll be discussing in the coming lectures, right? I hope you have heard about bronchodilators. So all of that information is in next lecture. Till then, thank you. Do like, share and subscribe to Learn Medicine by Dr. Nikita, and follow all our social media channels which we are available on Instagram, which we are there on YouTube, we are on Facebook as well. And there is an email ID on my YouTube description. You can drop in some questions on the video itself. I'll be more than happy to answer you. Thank you.